So thank you for joining us, Becky. This is Bekky Hobbs from Castle Vets in Launceston. I am Catherine Timms from Seaver Animal Health. So today we're going to be talking a little bit about Q fever and what Becky's been doing on some of her farms. So to start with, Becky, tell me about the farms you've been working with and what signs you've been seeing on farm.
Okay, so there's two different herds that I've had in the practice that have had problems. One, they're very different farms. One is a flying herd. They milk about 80 cows. They buy in all different sizes, breeds. It's a totally mixed herd. They don't keep any young stock on farm. Everything's gone by 42 days as long as they're not down with TB. And they don't breed any replacements at all. They just cull stuff and buy new cows in. The other farm milks 120 pedigree Holsteins. They are semi-closed. They've bought 5 new heifers in the last 5 years, so not very many new animals coming on farm at all, and they all come from one other farm. And they will occasionally buy a bull, but they've not bought one for several years. So they don't have a lot of new stock coming onto the farm, and they milk about 120.
And what clinical signs were they seeing?
So the flying herd, their fertility is never amazing to start with, and they synchronise a lot of animals with a fixed time AI to get them pregnant. They started to see sick cows from the beginning of this year. They already vaccinate for most of the common infectious diseases, and they were seeing mainly respiratory and gut type signs. So we did quite a lot of testing and didn't find anything. And they had several cows that died, all for varying symptoms, but a lot of them carried a pneumonia in an adult cow, and several of them had also scoured. The only things we'd found were things you'd probably expect to find on farm, like mycoplasma or RSV, but you wouldn't expect them to be killing adult cows. And then we had 4 cows that aborted in 1 week, and we tested those, and they were all highly positive for Q fever. We had previously tested the bulk tank a month or so before that was negative, but we're going to do that again in a couple of months, and that will hopefully have gone positive. But they saw real mixed signs really. Whereas the other farm, they had some problems the year before with fertility in heifers, and they didn't lepto vaccinate, and they were positive for lepto, so we tried to get them to vaccinate for lepto at that point in time, but they didn't. The following year they then they had sick cows, so just one-off sick cows. So again, we tried to push the lepto vaccine at that point in time, and they did vaccinate, and the sick cows seemed to stop, but then their fertility just took a massive nosedive. So their fertility is normally very good, and it just completely dropped off. So I'd regularly scan 25 to 30 cows to PD on a routine, and they'd all be pregnant, and we had like single figures that were pregnant just over one routine. And then that's when we did some more testing and found the bulk tank was positive for Q fever. So different symptoms on both the farms, but
Thank you. And what made the farmer decide to vaccinate in both cases?
I think we'd done a comprehensive investigation on both farms to try and find out what the problem was. The flying herd, we really didn't have anything else that was positive other than the mycoplasma and RSV, and they had high worm count as well. But I think it all just looked like things that were happening because the cows weren't very well, rather than those being the real causal problems. Whereas the other farm, that's other than the lepto, that's all we'd got that was positive. So I think it was that we tested for a lot of things, and that was the only thing that we'd found that was positive, and they were both having significant problems, so we're desperate to do something to try and fix the problems really.
And how are they getting on since they vaccinated?
So the pedigree herd, that's longer ago. So that was this time last year when they vaccinated, and they've done a lot better. So the fertility, it isn't quite back to where it was before, but it's definitely improved a lot on what it was. So on a routine before, we would very rarely have an empty animal, just because he's really good at heat detection, and his routine's every 6 weeks, so they've had time to come back round again before I PD them. Whereas if we scan 25, 30 cows now, there still might be 2 or 3 that are empty. So it's a little bit lower than it was, but it was definitely not down at the single figures that we're having pregnant. And that is the only thing that's changed on that farm, is that they've done the Q fever vaccine. And then the other farm, that's a lot newer, so it's this year that's all happened. So they've probably only had their second dose of vaccine in for about 6 weeks, but their fertility is better than it has been for many years already. So all the cows that are aborted have cleaned up nicely, whereas they would regularly have problems with cows being dirty for long periods of times. And the last routine I did, all 7 cows were pregnant, which I can't remember the last time I did their routine, and everything was pregnant. So I think that's got a bit more time to be sure that it wasn't just a one-off, but definitely they've not had any sick cows either since they've vaccinated. So hopefully that has settled it all down.
Brilliant. And how's the farmer feeling about it all now?
I think they're definitely relieved. The flying herd that were having problems this year, they were at a point where financially they were really, really struggling. They couldn't buy any new cows in. The bank were being pretty harsh with not lending them any money, and we've definitely had to do financial things with them as a practice to try and help them get through this. So I think they're very, very relieved that it seems at the minute that it has worked, and that is the answer. I think the other farmer is also very happy that he's not in the position that he was before, and that we did find something that he could do something about. But I think he probably would like his fertility back where it was, and we're just not quite there at the minute with him. That it's possible that it's some other factor like nutrition or something like that that's affecting the cows. But I think overall they're both very happy.
And you're not a stranger to Q fever, from what I understand. Could you tell us about your experience of Q fever in the past?
Yeah, so I caught Q fever when I was at vet school in second year. I got like a meningitis-y type symptoms with it. I was really neurological. For a brief period, they thought I'd probably got a brain tumour, so I was quite poorly. It took quite a long time to get the doctors to accept that it was Q fever. Despite having a rising titer that had gone sky high, they still weren't really sure that it was that. And it wasn't until they did refer me to the infectious disease team at hospital that we actually got on top of it. So I think it's hard convincing GPs in the UK sometimes that they need to test you for that. And I was just very lucky that uni told me to be tested for it once I started with the symptoms. So I don't think if they hadn't have pushed for it, I wouldn't have pushed for it either, and probably wouldn't have got to the bottom of it. So I had treatment when I was at uni. I had 3 months of doxycycline, and then I was absolutely fine. Within days of starting the treatment, all the neurological symptoms settled down, and then I had my titers done every 6 months, ongoing from that. And about 4 years later, they started to rise to the chronic form. So that was when I was 2 years in practice. And then I got poorly again. The symptoms came back exactly the same. So I asked to refer back to infectious disease, because I'd moved from uni to my job. I was in a different part of the country. So it was a different infectious disease team, but they'd had a lot of experience with soldiers coming back from Iraq with it. And so they treated me, and I had 18 months treatment at that point in time. So it was 18 months of antibiotics and a malaria treatment, which was a bit scary because that can make you go blind. But I was really poorly, so it just had to be done, and that was that. And then I've been fine since then. They're pretty sure that should be it sorted. And yeah, I've not had any symptoms or anything since. So it definitely does exist, and it definitely is real. I'm just one of those very unfortunate ones that's in that 2 to 3% that it makes quite poorly.
That's really interesting. Thank you very much for sharing that. So thank you so much for your time today. It's been really interesting learning about how you've been working up with Q fever, and we'll see you soon.
Thank you.